believe that the abortion pill, mifepristone, is safe and should be prescribed without an in-person visit with a physician?
Thank you so much, Senator Cassidy, for your question, and also thank you so much for meeting with me virtually before the hearing, and also to your staff for meeting. I think that every medication has risks and benefits. I think that all patients need to have a thorough conversation with their doctor and have true informed consent before taking any medication.
Should there be an in-person visit required?
This is the question of whether there should be an in-person visit is out of the purview of the Surgeon General's office, but I do believe that every patient needs to have a very thorough conversation with their doctor before taking any medication. Unfortunately, in our current healthcare system, because of how overburdened doctors are, this often doesn't happen, whether it's in person or online.
Do you believe that birth control is safe, should be widely accessible, including perhaps without a prescription?
I absolutely think that oral contraception should be widely accessible. Just as I said with mifepristone, I believe that especially when it comes to oral contraceptives, we need to have patients having a conversation with their doctor about risks and benefits. Like all medications, oral contraceptions do have significant risk, and we need to make sure that women are empowered with information and informed consent before getting on a medication that's often prescribed for several years without follow-up.
Tragically, next question, we've had 2 children die from measles in West Texas. We now have an outbreak of like 1,000 children almost in South Carolina area. You're a mom. We're on the verge of losing our measles elimination status. Would you encourage other mothers to have their children vaccinated against measles with the MMR vaccine?
Like you, I'm a physician. I believe vaccines save lives. I believe that vaccines are a key part of any infectious disease public health strategy. And I would work with you, the CDC, the NIH, ACIP,
But would you encourage
FDA.
mothers to vaccinate their children with the MMR vaccine, seeing how we've had children die in this outbreak in South Carolina?
I'm supportive of vaccination. I do believe that each patient, mother, parent needs to have a conversation with their pediatrician about any medication they're putting in their body or their children's
You're the
bodies.
nation's doctor. Would you encourage her to have her child vaccinated?
I'm not an individual's doctor, and every individual needs to talk to their doctor before putting a medication in their body. I absolutely am supportive of the measles vaccine, and I do believe vaccines save lives and are an important part of the public health strategy.
We've had a tough flu season this year. Would you, as past Surgeon Generals have, encourage Americans to get vaccinated with the flu vaccine?
At the risk of